Welcome to Smile Squad. Our mission is to be the warmest, funnest, bestest, clinically excellent kids dental office for everyday families here in Las Vegas. We believe that if you as a parent understand these 8 concepts, it is almost impossible for your child to develop a cavity. At what age does the American Association of Pediatric Dentists recommend a child brush without help? 8 years old or when they are able to tie their shoelaces without help. This means they've developed enough dexterity to appropriately brush. Please be encouraging and do not skip mornings or evenings. Children might not like to brush, but if a routine is developed, their resistance will decrease dramatically as they know it is not a choice or negotiable. So you as a parent, be strong. What is plaque? Plaque is a gooey layer that bacteria make when bacteria eat what we eat. While it may look like a layer of food, plaque is full of bacteria when observed through a microscope. This layer called plaque becomes a bacteria's home, and if allowed to sit on teeth for an extended period of time, a cavity will form. How long does plaque take to form on teeth if not brushed or flossed away? It only takes 1 to 2 days for plaque to develop and be visible to the human eye. This is why it is very important to brush and floss correctly every day. Once a parent knows how to identify plaque, it is easier for that parent to assess whether the child is brushing effectively. Here's the good news. No plaque means no home for bacteria, which in turn means no cavities. Are cavities a normal part of growing up? Cavities are definitely not normal and can be prevented with proper brushing, flossing, and diet. Now, there are cases where certain medications, radiation therapy, or genetic disorders can decrease the protective properties of saliva. Unless your child fits one of these categories or other rare conditions, proper oral hygiene, diet, and dental visits can completely prevent cavities. Do cavities hurt? Cavities only hurt if they are close to the nerve. A cavity has to get through the white enamel layer and the yellow dentin layer for the nerve to feel pain. Once at the nerve, infections can develop and lead to dental emergencies. What makes our office special is that we do everything we can to prevent cavities. This is a team effort between parents, the young patient, and Smile Squad. What are some goals of every 6-month dental appointment? Well, our number one goal is to prevent cavities and maintain healthy gums. Cleanings help remove any plaque that is beginning to harden on its way to becoming calculus. This should only be removed with special dental instruments by a dental professional. The 6-month checkups reinforce proper dental hygiene and diet with the parent and the patient. In particular, a child's diet is largely dependent on groceries that are bought by adults at home. Kids will always want the better tasting, sugary food, but it is up to the parents to limit those options. A child's oral health is truly a team effort. What creates a cavity? Soft enamel or bad bacteria in plaque. Plaque is a home for bad bacteria that create cavities. As the bad bacteria eat the sugars that we eat, acid is produced, which dissolves tooth structure. A cavity that is in enamel may have the ability to heal if the plaque is disrupted and bad foods are limited. Once a cavity gets to the dentin layer or close to it, a filling is needed. 6-month checkups are key to catching cavities early. Can bad bacteria be transmitted from the parent to the child? Yes, the bad bacteria that causes cavities live in everyone's mouth. The difference is that there are more of these bad bacteria in people with cavities. So if a parent has cavities and they share a spoon or a straw, well, guess what was just passed on to the child? A high dose of that bad bacteria that can now create cavities on the child's teeth. It is important that the parent is cavity free to eliminate this source for bacterial transmission. Let's recap. Brushing and flossing breaks up the bacteria's home called plaque. Bad bacteria are at higher levels if the diet is poor or parents themselves have cavities. If plaque is removed every night, there is no way a cavity can form. That's how you prevent cavities. Armed with the proper knowledge, your family and our team will work together to stop cavities from forming for the rest of your child's life.